Ma'am, that's not a corn, unfortunately. No, no, it's not just a callus either. It is, unfortunately, a plantar's wart. As a podiatrist, I see plantar warts every day. And this was a pretty large one. These are viruses in the skin, unlike a callus or a corn like this, or a foreign body like a splinter. These are different things that can come up, like if you have a piece of shard glass or a granuloma that develops. These are not warts. This is warts. These are warts, basically. You know, a wart is a viral infection of the human papillomavirus, actually. It is seen very well with the dermascope. I use this every time I look at a wart. It just gives me a better view of it. And once I kind of look at it and debride or shave down the hard callus overlying the wart, it'll bleed. It'll bleed very distinctly like this, what we call petechia. These are blood vessels that basically feed that wart. And the first treatment I always try is cryotherapy. Cryotherapy essentially is trying to freeze the wart, elicit an immune response. We're trying to destroy the viral infection within that tissue. And as you can see, I'm kind of focusing that cryogen liquid into this area of the wart. And it's almost boiling off. So what it's doing is essentially taking energy from the skin to boil off the cryogen liquid. And in result, it freezes the skin. It takes away the energy from that area of the skin as heat. So what we're looking for is something like this. We want to see it kind of be a scab. I'll shave that down. A lot of times we'll get good skin underneath. These are areas of warts that sometimes can spread. This case right here, it went to the heel as well as in the front of the foot. And this is a patient that just ignored it, thought it was a callus, thought it was like a little area of corn. But these can spread very easily. And we don't want them to spread because they can get very difficult to treat. And they can be on areas of the front of the foot and the bottom of the foot where they can be hard to treat. So here I'm utilizing a laser. Laser treatment can be quite painful unless we numb up the area. Of course, numbing up the area can be painful in and of itself, where we utilize a needle to inject anesthesia. But what we're trying to do is essentially hit it with a deep, quick amount of heat. And that heat essentially is trying to destroy the viral cell wall. Again, trying to elicit an immune reaction. We see this nice little scab that has developed, and essentially that is what we want to see as it starts to resolve the wart. So here's a wart that was treated with the laser. It will continue to develop this hard callus skin. The darkened areas are basically dried up scab. We want it to actually blister up slightly underneath the skin and essentially kill the wart. And as I'm shaving down all this hard, dead skin, we want eventually the warty tissue to go with it. Now, some docs will soften up this area with a softening agent. I prefer to leave it a little bit harder just so that I can really make sure I'm cutting away just that hard, calloused, hyperkeratotic tissue without going into softer, good tissue there. But it will continue to develop callus until the wart is completely gone. So again, that's why whenever you've got a little bit of a corn or callus, you really need to look at it or have it looked at by a podiatrist just to make sure that, hey, is this a wart or is this a callus? So again, we want to clean all this up. This will also allow us to treat it again, and hopefully eventually we'll get down to good skin once several treatments have been done. We usually will spread the treatments out 3 or 4 weeks apart. This patient also had a wart on the heel, and again, that dark scab dried up blister is there. Again, that's the main reason why we don't want to ignore warts. They will spread if you give it enough chance. And often if they're on a heel like this, it can be painful every time you take a step. As you can see, I'm trying to be as careful as possible. The heel's got some dense skin. We don't want to puncture into good skin and make it bleed. But again, that is a pretty good treatment there, but we'll treat it again. This time we're using a microwave treatment. This is a little bit newer treatment in most recent years. It uses a deep heat to elicit an immune response. We hit it with about 2 seconds worth of microwave heat, that is, and treat it for about 2 seconds each time. So the patient does feel some discomfort, mild pain, but if it's very painful, then we can always numb it up with a little anesthetic.
Round 3.
And again, for really resistant warts, this is a great way to go that next level of treatment. This is another patient with multiple mosaic type wart is basically what we call this. It's been there for about 2 years. This is very difficult to treat, but a combination of laser and microwave, we were able to resolve it. And you can see here he's all cleared up. Now this is a patient who failed at cryotherapy, failed at laser, and failed at microwave. So we decided to opt for outpatient surgical excision. Patient's sedated, he's anesthetized locally, and essentially I am going in there to cut out that top layer of the skin along with all the wart. We don't want to go too deep into the fat layer. And once this is excised, we don't want to just leave it. We really have to make sure we're lasering now the base layer. And you can see that laser is cauterizing the tissue that's remaining. We want to try to kill any remnants of any viral tissue that may be still within that skin. I'll curettage this area and bandage it up, and he'll be doing local bandaging for about 3 or 4 weeks. This is now 4 weeks out. Patient's doing very well. He eventually resolved completely of his wart and was very happy. So bottom line is, the quicker we can treat that plantar wart, the easier it's going to be. Don't wait too long for them to be treated. And if you're still not sure whether they're gone, definitely see your doctor. And let's get them treated much quicker and much more effectively with the methods that we've got. So kids, let your mom and dad know that you've got plantar warts or something on the bottom of your foot and you're not sure what they are. And adults, let's not just ignore it. Let's get in, bite the bullet, and let's get treated so we can get rid of these virus creatures invading our skin. So hope this was informational. Make sure you subscribe, hit the little bell icon so you can get notifications the next time I upload a video. I'm often really busy, unfortunately, so be patient. I'll upload as much as I can. And again, I appreciate you watching, and I hope you learned something. Till next time.